In a war against nature, my body will try to fight off these enemies so that I don't die.
At first, it's disconcerting to hear Abby Wold, a young woman filled with joy and life, read a poem about staring down death.
Are they right? My last rites? Will tonight be my forever goodnight?
Abby's poem is about her fight with a bacterial infection that strikes between 1,000 and 2,600 Americans every year, 1/3 of them teens and young adults.
By the time we got to the emergency room, I couldn't walk anymore. They had to push me in a wheelchair. And the last thing I remember for a while is telling the nurse, I think I have meningitis.
Abby's battle with meningococcal meningitis began in the Tampa area in 2003 when she was 22. At first, she thought she had a fever. Within hours, she was fighting for her life.
From there, I don't really remember much. A lot of things happened between there and when I woke up. I had multiple organ failure, obviously. I ended up on a ventilator and in a coma.
Abby eventually awoke from her coma, but she ended up having both legs amputated below the knees. Today, she continues to face medical challenges.
Surgery, rehab, surgery, rehab, surgery, rehab. You know, it's just become a pattern.
A number of serious diseases, like the one that almost killed Abby, spread easily because of the close personal contact that many adolescents and young adults share. That is why the Centers for Disease Control and Prevention recommends preteens and teens receive these 3 vaccines: the tetanus diphtheria acellular pertussis vaccine, or Tdap, the meningococcal vaccine, and the human papillomavirus vaccine. Despite the availability of these potentially life-saving vaccines, immunization rates for adolescents are significantly lower than immunization rates for young children.
I think we tend to think of immunizations as a kid's thing to do, and so we're very good about immunizing kids, but we get less good about immunizing people as they get older. And so our immunization rates for adolescents aren't nearly as good as they should be for vaccines like Tdap, tetanus, diphtheria, acellular pertussis, or the HPV or human papillomavirus vaccine, or the meningococcal vaccine.
The consequences of these lower preteen immunization rates are being felt across the nation.
State health officials say more than 6,400 cases of whooping cough have been reported this year.
Matthew's doctors suspected it could be whooping cough, also known as pertussis.
We have seen outbreaks of pertussis in California and South Carolina, statewide outbreaks. We've also seen regional outbreaks in Michigan, New York, North Carolina, Ohio, and Georgia. So we've seen them in many states in the United States.
Pertussis, or whooping cough as it's commonly known, begins like a bad cold, followed by an uncontrollable cough. It's a potentially deadly disease, particularly for infants. Whooping cough was thought to be under control, but recently a number of states have experienced waves of pertussis cases. That's largely due to low vaccination rates among adolescents. According to the CDC's 2009 Teen National Immunization Survey, just 47% of Florida's 13 to 17-year-olds had received a Tdap pertussis booster shot, a booster shot that teens need as immunity to pertussis wanes in the teen years.
And what's happened with pertussis is we've found that protection provided by the infant vaccine wanes over time. The antibodies that you develop when you receive a vaccine, you lose those antibodies over time, and so your protection goes away. And so that's why we are now seeing adolescents with the disease pertussis, and we know that those adolescents can spread pertussis to their classmates, to their housemates, to younger children, in fact. So that's another thing that we're seeing with pertussis as well.
Although the Tdap vaccine is recommended for all adolescents, including in California, the immunization rates among them is about 40%. It's also recommended for adults who live in the home of someone who was just born, and immunization rates are about 6%.
In 2010, the CDC says there were 21,000 cases of whooping cough and 26 deaths. California experienced its worst epidemic in 65 years.
Look at the pertussis outbreak or whooping cough outbreak in California. 10 children have died. All those children are less than 3 months of age. All of them were too young to be effectively vaccinated. Where did they catch that bacteria from? Most likely from someone in the home. Most likely from parents or an older sib.
All students entering, attending, or transferring to the 7th grade in Florida are required to have 1 dose of the tetanus diphtheria pertussis Tdap vaccine. And in 2011, the CDC expanded its Tdap recommendations. Adolescents 11 to 18 years of age, preferably at age 11 through 12, should receive a Tdap dose. Children 7 through 10 who are not fully immunized against pertussis should receive a Tdap vaccination. A Tdap dose can also be given regardless of the timing of an adolescent's last tetanus and diphtheria booster. All adults need a one-time dose of the Tdap vaccine. Adults who just received their TD booster and anticipate being around infants and young children do not need to wait for a Tdap dose. And adults 65 and older should get a dose if they anticipate being around infants. For other adults aged 65 years and older, a single dose of Tdap vaccine may be given instead of TD vaccine in persons who have not previously received Tdap.
Pertussis is still a disease that's uncontrolled in the United States. It can be with vaccination, but we're not there yet. We need to achieve those higher than 90-95% levels of coverage in order to prevent transmission.
While the medical community is working to raise pertussis vaccination rates, another adolescent vaccine has posed an even bigger challenge for healthcare providers. It's a vaccine that protects against human papillomavirus, the most common sexually transmitted virus in the U.S.
It's a really common infection. Approximately 80% of women at some point in their life will have been infected with human papillomavirus.
Dr. Anna Giuliano is a researcher at the Moffitt Cancer Center in Tampa. She and her colleagues conducted a study that found human papillomavirus, or HPV, is not only common in women, it's also common in men.
In our studies, and we're studying men in 3 countries, in Brazil, Mexico, and the United States, we see that around 50 to 60% of men will have HPV at the external genital epithelium.
Most women and men are able to effectively clear the HPV infection through their own immune response. But for others, HPV can create lifelong health issues.
The most common health problem for both men and women is genital warts.
But HPV can also cause several cancers in men and women, most notably cervical cancer, which the CDC says about 10,000 women are diagnosed with every year. About 3,000 women a year die from the disease. The HPV vaccine is available as a 3-dose series for males and females to protect against the types of HPV that most commonly cause health problems.
CDC recommends HPV vaccine for females 11 and 12 years of age, as well as vaccine doses as a catch-up for females 13 through 26 years of age that didn't previously receive the doses of vaccine.
The HPV vaccine may also be administered in a 3-dose series to males aged 9 through 26 to reduce their likelihood of genital warts.
And this vaccine is highly effective. We're talking close to 100% effective in preventing the infections that the vaccine is directed against.
Despite the protection the HPV vaccine provides, coverage levels among adolescents remain low. According to the CDC's 2009 National Immunization Survey, only 39% of girls in Florida received at least 1 dose of the 3-dose HPV vaccine series. Nationally, that rate was only 44%.
We want to vaccinate prior to sexual exposure. But that really then becomes so dependent on the physician initiating the conversation.
Parents and patients are not always going to know exactly at what age sex is going to begin. So it's very, very important that you give a dose of vaccine before that.
In terms of cancer, this is the best news we've had in a very, very long time. We need to capitalize on it.
It's incomprehensible to me that we have a way to eradicate this disease and we're not going to do it.
Dr. Guy Ben-Ruby, a gynecological oncologist at Shands Jacksonville Medical Center, has seen women suffer and die because of cervical cancer. He says it's frustrating to see so many adolescents not receiving a vaccine that's 100% effective in preventing the HPV infections that cause cervical cancer.
The vaccine was released in the summer of 2006. 4 years later, if we look at all the potential recipients of this vaccine, in other words, all the kids from 11 to 26 that could be vaccinated, only 12% have been vaccinated. So this is a very terribly missed opportunity. There are literally millions of kids that got infected with HPV between 2006 and now that should not have been infected.
Abby Wold knows thousands of Florida teens are also missing an opportunity to protect themselves from meningococcal meningitis. Today, as a Florida team leader for the national nonprofit group Meningitis Angels, she fights to focus attention on the meningococcal bacteria, a bacteria that as much as 15% of the population carries in the nose or throat.
You could be carrying it now and, sneeze on someone. You wouldn't have no idea you're carrying it, and they could die by tomorrow. That's the scary thing about it, and people don't realize that.
The Centers for Disease Control and Prevention recommends all 11 to 12-year-olds receive the meningococcal conjugate vaccine. Because immunity begins to drop off, teens should also receive a booster dose at age 16. If vaccinated at age 13 to 15, a booster is recommended at ages 16 through 18. Adolescents who receive their first dose of meningococcal vaccine at or after the age of 16 do not need a booster dose. Following these vaccine guidelines can help prevent the spread of meningitis in places like dorms and summer camps. But the CDC says that as of 2010, only 1 in 2 Florida teenagers had received a meningitis shot.
Well, we teach vaccinated every opportunity. That is because a lot of our teenagers do not come in for regular checkups.
Vaccine registries like Florida Shots can also help increase adolescent immunization rates by keeping track of shot records and reminding providers and parents what shots are due. The Florida Vaccines for Children program helps remove another barrier to adolescent immunization, the cost of the vaccines. Any Florida licensed healthcare provider can enroll in Florida Shots and the Florida Vaccines for Children program for free. Easy online enrollment applications are available at www.flshots.com for Florida Shots and www.immunizeflorida.com/VFC for the Florida Vaccines for Children program. Abby Wold says it is critical that providers take advantage of Florida Shots and Florida Vaccines for Children.
Vaccinations save lives. I can prove exactly what bacteria and what serotype did this to me. And it could have been stopped by a vaccine.